Hi, I'm John McGuire, founder and director of the Kinesiology Institute. Thank you for tuning into this video. And be sure to subscribe to our channel and click the bell to be notified when we post new content. And go to kinesiologyinstitute.com to learn more about applied kinesiology. In applied kinesiology, we use muscle testing as a biofeedback indicator of what's going on in the body. It gives us information of where there's both structural imbalances and energetic blockages that we can then correct. So it helps you to work smarter, not harder, and to find the source of the problem. So what I'm going to show you is how to do accurate muscle testing. This is one of the biggest challenges that people often have, is they say, well, I can't muscle test. Primarily, it is doing a slow, gradual increasing pressure as the person you're testing meets your pressure. You always want to emphasize to them it's not a strength test, but a gentle, relaxed hold against gradual increasing pressure to then determine whether energy is flowing and the structure is balanced, or whether there is a blockage or a stressor. So when a muscle that's strong then tests weak, say when we're touching a various part of the body, which I'll be demonstrating, that's saying, oh, the body is under stress in that area. Then we can determine what will remove the stress. And the beauty is, when you remove the stress or the blockage, symptoms will often go away naturally. And I love this. Throughout my massage practice, I was able to quickly find what was the area I had to work on, as well as what was the approach that was best to use to bring the person back into balance. So I found I've gotten results very quickly, and it gave me confidence of what to do. See, when I first became a massage therapist many years ago, I learned all these techniques. The challenge was I didn't know what technique to do when. So I would literally throw my toolbox at people, hoping, will that help? Will that help? Will that help? Well, then I was honored and had the great privilege of studying with Dr. George Goodhart, the founder of Applied Kinesiology. And what he said, John, what you're doing is the rub and hope method. So I learned all these massage techniques, and where someone hurt, I would rub and try that. Oh, that didn't feel better. Let's try this technique. And whether I use heat packs or cold, ice packs, I didn't know. And then when I learned muscle testing, it told me what I needed to do when, and I eliminated the guesswork and got so much better results quickly and efficiently. And sometimes just in seconds or a couple minutes, people would have corrections. Like Marcus Shaw, he came to one of my classes and he found a problem he had had for like 5 or 6 months. And in literally 60 seconds, a technique that we did in the class, which I'll be teaching you, eliminating blockage to where his shoulder muscle had energy blockage. And it wasn't working on the shoulder, it was working on a reflex. I saw him 2 years later and he said, you know that technique you spent about 60 seconds in the class working on me? Well, it eliminated my shoulder problem and it never came back. So you often get substantial results with just the littlest, easiest corrections, because you're working exactly the points that will then switch on the energy and create structural and energetic balance. So we're also going to be showing how you can use muscle testing to find what the stressors are. Sometimes it's emotional stress. Dr. Goodhart had many patients that were part of the motor industry. He was a chiropractor in Detroit, Michigan, and so he had many executives that came to him, and they would often have low back pain. And what he discovered was their low back pain was from the emotional stress they were under to meet quotas and to manage these major operations. So he called it emotional low back. There are other times where it may be a structural factor, where the muscles are imbalanced. And so we'll be showing you how you can discern that and know what to do when. So I'm going to bring up Catherine now, and we're going to show how to do accurate muscle testing. So Catherine, what I'm going to do is a procedure where we're going to have you bring your arm straight out in front at about 45 degrees, and I'm going to put light, gradual increasing pressure, and you're going to meet my pressure to evaluate whether there's any energy blockages or stressors in you, okay? So any problems with your shoulder that I should be aware of, or are you fine?
Okay.
Okay, great. So what I'm going to do is I'm just going to press lightly, and as I push down, you meet my pressure, okay? Ready, and hold. Great. Now, the arm stayed fine and in place, so we consider that a switched on muscle. Now, I want to be sure that we're getting accurate information, so I'm going to do something to switch the muscle off. Right in the belly of the muscle here, there are nerve cells. If I pinch them together, let's see if the arm responds differently. Okay, ready and hold. Wow, you see that go, that switched off, okay? Now, after I can pull it apart, tell the muscle to go back strong and see what happens, and it is. Great, so that's telling me where your on and your off is, okay? So let's check some points on your body. Now, what I can do is I can touch particularly specific acupuncture points and see if anything switches off, okay? And meet my pressure, okay, good. And here, good. All right, let me check a point over here. Oh, look at that. I'm touching a specific acupuncture point that's on the large intestine meridian, happens to be large intestine 11. And when I touch the point, hold again, see how it goes weak? That's telling me there's energy blockage there, all right? So what I can do is I can apply a little acupressure and just relax your arm here. Is that tender at all there?
It is.
Yeah. Well, the greater the tenderness, the greater the extent of the blockage. So, ooh.
Very tender.
Yeah. Okay, do you have any stress, energy blockage? Do you have like low energy at all, or how's your body feeling right now?
I'm feeling all right. Just a little bit tense on my shoulders, but...
Okay, tense on your shoulders. Well, we'll look at that next, okay?
On the left side, yeah.
All right, and breathe deeply. Okay, so let's see how it tests after I applied the little acupressure. So again, it's strong. I touch here. It now stays strong, okay? Great. So now what I can do is, can you touch the shoulder where you're getting, is it up here and in the neck?
It's a little bit higher on this
Okay,
side.
on that side, okay. Okay, so I'll use the arm again, and if it gets tired at all, I'm not putting much pressure. I'm just putting about, say, 4 to 6 pounds of pressure, just the weight of my arm, and I follow through a little more, a little more, a little more. Okay, see now when you're touching it, how it goes weak? Take the hand away, and it's strong, but touch it again, and it's weak. Now, there are reflexes for that area, so I can touch those reflexes, and let's see what happens when I touch a reflex if it goes weak. Yeah, there's a point there. Let me touch some acupressure points back here. Oh, there's one right there. Okay, let me check something right here. Now, what I'm doing is I'm touching reflexes for the muscles that are up there. They're like energy switches. And if a switch is blocked, see, when I push and I touch that switch, this is for the neck flexors and neck extensors, that's showing weak. Now, I can even touch in the belly of the muscle here and see what happens, and see how that goes weak. So it's telling me whenever I touch an area and there's stress, it will switch off. Now, you touch right here with the left hand, okay? Now, you're touching the switch, so I'm going to go back and touch the neck muscle and see when you touch the switch, do you see how it now goes strong? So again, take the hand away. The body's saying, we have stress in the neck extensors. And then I say, touch the switch for the neck extensors. These are lymphatic, neurolymphatic points. And it says, oh, that'll make me better. So on a scale of 1 to 10, what would you say your neck stress is right now?
Maybe at a 6.
At a 6, okay. So what I'm going to do, I'll see if there's any other points that might be helpful for that. So I'm going to, I'll touch right over here and see what happens. Okay, and here. Okay, so there's a point here that's testing weak. Okay, I'm going to touch a point here and see if that's weak. Yeah, these are neurovascular switches for the neck muscles. So I'm going to do both the neurolymphatics and the neurovasculars. And you said you're at a level 6. Okay, do a little range of motion and see if there's any tenderness there. Is it harder to turn to one side or the other?
Yeah, it's on my right side a little bit.
Okay, So when you turn to the
seems
right,
okay.
okay? Now before we do that, I'm going to do another technique. And in fact, let's have you hold the arm up here and turn your head to the harder side to turn. So to the right and hold again. Do you see how that goes weak? Now the first technique we're going to do before, this is called the ear unrolling technique, and it also is excellent for relieving neck stress. So let's demonstrate that first. So notice how far you can turn here. Okay? Now what I'm going to do is while you're turning, I'm going to start unrolling the rolled over part of your ear, and you can do this of course on yourself, and for you that are watching, you can do it on you, and see if your head goes any further as we do the ear unrolling technique. So I'm just unrolling the ear and pulling it away from the opening, and what this does is it releases nerve endings in the ear. In fact, I can do both sides, but are you seeing any more range of motion? It looks like you're moving better. Okay, I'll do the other ear here too while we're at it. So just unrolling the rolled over part of the ear. The ears also act as antennae for the acupuncture meridian system, which has bioelectrical energy known as qi. And that qi then gets activated, as well as nerve endings coming from the ear going through the neck get stimulated to bring about better range of motion and relaxation in the neck. So let's see what we've got. Okay, come back to center and then turn again and see if you got better range of motion.
Oh yeah.
Yeah?
Definitely,
Okay.
yeah.
Now, while you got that range of motion there, let's test the arm. So again, as far as you can go and hold. Much better range of motion. And wow, isn't that amazing? And the arm tested strong, meaning we've removed the stress. Now you had some points over here. There's one here for this is the upper, the reflex for the upper trapezius, this muscle here. So I'm going to rub here while I touch here. This is the neurovascular, meaning it stimulates blood flow to that muscle. This stimulates lymphatic flow within the muscle. Lymphatic system is your body's sewer system. So is that tender at all in there?
Very tender.
Very tender, okay. Now the greater the tenderness, the greater the extent of the blockage. It's removing stress by working on these points. Take a few deep breaths in, okay, and I'll work up here. This is the neurovascular point. And then we also had some points in the back. I'll stimulate the neurolymphatic point in the back. That's right at the base of the neck, right off of T7, or actually C7, right off C7 and T1. Okay, now there were some points in the front. So I'm going to rub these. Let's see if these are tender. These are for the neck flexors and neck extensors. Any tenderness there?
They're not as bad.
Not as bad, okay. And how about in the back here?
Where your thumbs are at, yes.
Yeah, okay. So I'm now going to work the points in the back. So I'm right here at about C2. Now, to note, I'm just off to the side. This is where she tested weak. That's how I know where to go with this. And in our courses, we give you all the different reflexes, but I'm showing you right now some great ones for the neck. And the body has all these reflexes for muscles throughout the body, and these happen to be the neurolymphatic reflexes, also known as Chapman's reflexes, and they end up, in many cases, activating a muscle to make it remove the stress from it, but also make it stronger. Okay, so now let's touch these points here. These points here stimulate blood flow to the neck muscles. These are light touch points. Neurovascular points you touch and then slightly tug, and these have been found to stimulate blood flow within the muscles and the related organs. Now, interestingly enough, this is one of the first points that Dr. Goodhart discovered that there is a muscle-organ relationship. He had a woman with sinus headaches who was his secretary actually working for him. And she came in with a sinus headache, and he noticed her neck was tilted to one side, indicating muscle weakness. What Goodhart discovered was it's weakness of muscles under stress that causes other muscles to be tight. In other words, he called it the opposing muscle weakness. So rather than taking and trying to release pressure and tension in a tight muscle, he said if we activate the weak muscles, then the postural lines, in her case her head came on straight, and she said, Doc, would that have done anything to release my headache? And he goes, really? He said, yeah, my headache's gone. And so he found by working these specific reflexes, it aligns posture as well as eliminates symptoms in many cases. So now I can touch these points again. This was the one that was weak earlier. And hold it, it's strong. This was a weak point. That's strong. This was weak. That's strong. Back here was weak. That's now strong. The neck muscles themselves, they're strong. And let's see how you feel. Earlier you said you were at like a level 6. So what's going on in there now?
I'm feeling at a 2.
Feeling at a 2. Okay. Great. Fantastic. So let's see your range of motion and
That's all the way.
yeah, great. Okay. Excellent. So there's a couple other techniques we can try. This is one that will release tight muscles. So let's have you lean over like this. And what I'm going to do is just feather over the muscle, just going lightly, briskly over the muscle, and see if this gets you even further down to a 1, meaning no stress at all. That was pretty significant from just a little bit of work. See, I didn't even do much neck massage, which I also incorporate this into a massage. This is a great way to start and then do your regular effleurage and petrissage and all your techniques. So any shift after that?
Feels good.
Feels good?
Yeah.
Even better?
Mm-hmm.
Great. Okay, well, that was pretty easy, huh?
Yes, thank you.
You're welcome. I'm glad you got a result. Okay,
Thank you.
you're welcome. So what we did is we found a switched on muscle. We call it an indicator muscle. It can be an arm or even a leg in any angle, any direction. But with their arm out straight, about 45 degrees up, I found that it would respond to a little pinching in the belly of the anterior deltoid, and it went down, and then we opened it up to make it switch back on, and she then had an indicator. We knew what her on and her off was. Then I asked her what was going on, and she said, well, I have some neck stress. So I started touching reflexes for the neck. Now, one of these is between the second and third ribs, about 2 inches out, and that is a energy switch called a neurolymphatic that goes to the neck muscles, both the flexors and extensors. So then another one I touched was over here, right on the border of the anterior deltoid, the internal or interior border. And when I touched there, it also went weak. That is a switch for the upper trapezius. Then I also checked points for the upper trapezius and the neck muscles. One back here was the upper trapezius vascular point, neurovascular, and then here was a neurovascular for the neck muscles. So all of those tested weak. Now, in our advanced courses, we actually show you how to test the muscles and evaluate it, which is great to have all that feedback, and then you can find out a muscle will be weak, and then you do the reflexes and it switches it on, like Dr. Goodhart did with his a secretary, Charlotte, who had, her head was like tilted to one side, and she had these painful sinus headaches. And then he worked the points I just showed you, and he goes, wow, your neck aligned. And she says, yeah, and my headache went away. And that's the beauty of this. Often when I'm working reflexes, people won't even tell me they've got all these other issues, and they go, oh, they're gone. So that's the beauty of this. You get right to where the energy blockages are. When energy blockage is removed, then you have a result where the body is in balance structurally, energetically, and emotionally.